Welcome back to iDental YouTube. Last video you joined us with Carl to go over resin crowns. Today we're going to go over the doctor's portion of the video. Please enjoy!
Dr. Nelson, to start, could you explain what a dental crown is and why a patient might need one?
A dental crown completely covers the top of a tooth. What it does is it makes it more resistant to decay, but the primary reason is to strengthen the tooth because we place them whenever a tooth has had root canal therapy or if it has a large restoration that covers more than 1/3 of the width of the tooth. It's basically a procedure that preserves the tooth. And nowadays it's also cosmetically pleasing because of the ceramics, that the crowns are very beautiful and it makes the tooth look brand new.
Can you walk us through the steps of a crown placement procedure?
When a patient is getting a crown, first and most foremost is good anesthesia. We numb the patient up just like they're getting a filling. Then we have to reduce the height of the tooth to make room for the crown, and we have to reduce the diameter of the tooth to make room for the crown. At our office here, we'll typically use an optical scanner to scan the preparation after the tooth has been reduced, and that gets sent through the internet to a dental lab to fabricate the crown. Or it may even be fabricated here using 3D printing. The intermediate step is we usually put a temporary restoration that's made out of an acrylic that they wear while they're waiting for the final crown to arrive. When the permanent crown gets here, frequently if the tooth has not had root canal therapy, we go through anesthesia again, and then we remove the temporary crown, we place and adjust the permanent crown and cement it with a permanent cement. If it's fabricated here with 3D printing, we can 3D print a resin crown and have it delivered in the same day.
And what are the different types of crowns available to patients?
Well, there's on the far bottom spectrum, if you will, we have stainless steel crowns that are prefabricated. They come in various sizes, but it's not the same as a custom fit crown. The custom fit crowns can be made out of they can be made out of gold. They can be made out of porcelain fused to a metal alloy, or they can be all ceramic and resin. I forgot about resin.
How long does a typical crown placement take?
Typically, to a crown appointment for the patient will be scheduled for an hour of chair time. And no, we don't drill on them for an hour. Typically, it takes about 7 to 10 minutes after they're anesthetized to reduce the tooth, both in height and diameter. And at that point, the assistant scans and they fabricate the temporary. And the patient's usually out the door within that hour appointment.
Are there any risks or complications associated with the procedure?
There really aren't any downsides when the appropriate selection process. For example, if someone's had a root canal therapy, frequently it's good to place a post within the tooth to strengthen it. It doesn't strengthen it like a rebar strengthens concrete. It doesn't make the material stronger, but it prevents the top part from breaking off. But there really isn't a risk to having a crown done. The materials are hypoallergenic, and we don't have responses to the materials at all.
How should patients care for their newly placed crowns?
Properly designed, their crowns should be just like their natural tooth. In fact, many times people will say it feels more natural than my big old filling that was in my tooth. Now it feels nice and smooth, and when I look in the mirror, my tooth looks brand new. They brush it, they floss it just like their own normal teeth. That's all they have to do.
Thank you, Dr. Nelson, for explaining the crown placement procedure. Your insight is valuable to our viewers.
Thank you.
Thank you for watching, and don't forget to like, comment, and subscribe. We'll see you in the next video, smile enthusiasts.